Hello, I'm Dr. J. Taylor Carlisle. I'm a specialist in infectious disease. I've been asked to talk about sepsis, and I'll just give a brief definition of it because it is not a highly well defined condition, but it roughly means a cascade of things that happens to the body when bacteria grow in the blood. Now, we have different ways of defining that, like sepsis syndrome, but a typical situation would be someone who, for example, got a urinary tract infection. The E. coli that caused the infection manages to gain access to the bloodstream and releases a series of chemicals called cytokines, and these have an effect on the human body of dropping the blood pressure by increasing the permeability of the blood vessels and raising the heart rate to pump more blood, and a variety of things that result in something we call septic shock. And that is a dangerous condition. It's caused by the endotoxin on the surface of the E. coli or other similar gram-negative organisms. There's a high fatality risk in the first day or two. That gets better as time goes on, and your body cleans up the mess, and we give antibiotics and so on. Now, there are other situations where you can see what we call sepsis, and we tend to use it as a shorthand for anybody who is sick with an infection, but it has a very specific definition with endotoxemia that I just described. Who's at risk? Elderly people, both male and female, because men as they get older get big prostates, which means that their bladder has trouble emptying, so it stagnates the urine and they can get an infection in that. And for females, especially who've had a hysterectomy, as they get older, their bladder falls down, they don't empty it. A 20-year-old girl may empty 80% of her bladder urine. But an 80-year-old woman, maybe only 20%. So that urine pools, get secondarily infected, and in the right situation, it can get access to the blood and cause a serious infection. The symptoms can be sudden, but they're usually altered mental status with confusion, severe weakness, profound, for example, loss of blood pressure, many times a high fever, not always, and high heart rate. That series of symptoms is called sepsis symptoms, and it's what lands people in the emergency room and then into the ICU. The treatment is supportive. We give IV fluids, especially saline, to keep the blood pressure up, and in turn this leaks out into the body and makes them swell up, but that's okay to price to pay. We give them medicines to support their blood pressure, and we give them antibiotics to kill the bacteria, bearing in mind that even when you kill the bacteria, it's not just the living bacteria that causes, it's the shell on the surface of the bacterium that actually is what we call endotoxin, and that's what makes them sick. So you can't just kill the bacteria. You have to do these other supportive things as well until their body can kind of clean up that mess. How do you prevent it? Several things. For older men and women, emptying the bladder is important. At the same time, what we tell our patients is to drink a lot of fluid so they can flush their bladder. Avoid taking oral antibiotics at the drop of a pin. Most people go to the doctor with a cold, they expect an antibiotic. The data are showing that this is not always the best approach. It may be what consumers want when they go to a doctor, but it doesn't necessarily mean that's what you need, because those things tend to, the more you take of oral antibiotics, it selects out resistant strains that are harder to treat. Other than that, it's hard to avoid. We're living longer. We're living into our 80s and 90s, and you're going to have greater incidence of infection. That's one of the prices that you pay for living a long time.